Welcome back to another edition of The Buzz by Dr. Z. I'm Christine Strigala. Joining me again is Dr. George Zalupko. Hi, how are you?
Well, hi, Christine, and welcome back to the Lung Disease Center of Central Pennsylvania. It's nice to have you here.
Thank you. I'm glad to be here. Today we're talking about COPD, and can you tell me exactly what that is?
Well, COPD stands for chronic obstructive pulmonary disease. These are patients where their airways are narrowed. It makes it difficult for them to get the air out and get the air in. And these are patients who, for the most part, have a history of smoking.
And the symptoms that you would have in order to come into your...
Well, it's usually the Trinity, Christine. The Trinity for us here is wheezing, coughing, shortness of breath. And if you don't have one of those, you probably don't belong here at the Lung Disease Center, although we do see patients with other types of complaints.
And how is it caused? How do you get that?
Well, as I said, smoking is the most common cause, but there are genetic causes as well. Some of our patients come to us with severe disease, and they're fairly young, say under the age of 55, and sometimes there's a family history of COPD. Many of these, well, not many, but some of these patients actually will have a genetic defect, which we can test for, and we do that fairly routinely here. And if they have that defect, we can supply them with replacement therapy, which prevents further damage from that defect.
So other than genetics, how exactly do you diagnose someone with?
Well, it really requires pulmonary function studies, and many patients come to us having been told that they have COPD, but really have never had a pulmonary function study to define it. Pulmonary function studies define the nature of their disease, that is COPD or not COPD, and it also tells us about the severity.
Can medications reverse the damages?
Well, unfortunately, medications can't reverse the process. We can, though, make you optimal. And so we talk to patients about what other things they can do for themselves, of course, stopping smoking, etc.
All right, Dr. George Zalupko, it's always a pleasure. Thank you for joining us today. And please join us again next month for another edition of The Buzz with Dr. Z.